Last week, top late-night talk show host Jimmy Fallon returned to The Tonight Show after a potentially catastrophic finger injury kept him hospitalized for nearly 2 weeks. Upon his return, Fallon told his audience that he had tripped on a rug in his kitchen and caught his ring on the countertop, sustaining what is known as a ring avulsion injury. Fallon's story is unusual, as I can't think of anything on a counter that could cause this. This was no minor incident. Fallon underwent an emergency 6-hour surgery in New York in an effort to save his finger. Ring avulsion injuries are rare and usually catastrophic. As the name implies, it typically involves the ring finger and a wedding ring. Most commonly, this injury happens when a person falls while reaching for something on an overhead shelf, catching the ring on the shelf, and essentially pulling the finger off as the finger stays with the ring. Other cases have involved the use of power tools when a person gets the ring caught on the tool itself. There are 3 types of ring avulsion injuries, classified 1, 2, and 3. Type 1 is the more minor injury, where the blood vessels are adequate and the circulation is normal. Standard treatment involves just treating the soft tissue or bone injury. The second type is when the blood vessels have been injured, and these have to be repaired to preserve the finger, allowing repair of the other injured areas. Finally, the type 3 is the worst. This involves a horrific degloving, or the ring pulls off the whole soft tissue envelope of the digit, or even amputates through the tip of the finger. Revascularization preserves the digit, but there's usually very limited function after this. This is actually a type 2 injury that is likely what Fallon had, where you can see the tip of the digit is still there. It's just opened up the soft tissue. There's a lack of blood vessels here and circulation to the tip, but the bone and the tendons are intact. Because this injury is not a clean-cut injury, the microscopic blood vessels are usually stretched or torn and cannot be repaired without removing the damaged vessel and bridging the gap. This is done with either an artery from an adjacent finger, or as in Fallon's case, his foot. This is actually a microscopic view through the microscope that we are looking at when we repair these blood vessels. This is a digital artery in the finger. It measures 1 millimeter in diameter. The arrow, the yellow arrow, is the very tip of the lacerated or injured digital artery. The repair is with a very fine suture, thinner than a human hair. Fallon was kept in the ICU post-surgery, not because he was sick like the other patients, but so that the finger could be closely monitored for circulation. This was merely a safety precaution so if the circulation stopped, he could be taken back to surgery quickly. After 10 days in the ICU, the circulation is usually well established and he was discharged. The key to Fallon's injury and his prognosis is what else was injured during the incident. The media has reported that it will be an 8-week recovery, a very speedy time frame for this type of injury. For this to be accurate, there would have to be no fracture or tendon injuries, and Jimmy would have to begin rehab right away. If in fact there was a tendon injury or fracture, he could well be looking at a recovery that may last as much as a year. With a blood vessel injury, there is frequently a nerve injury and loss of feeling to the digit. In some severe cases, the finger may need to be amputated later if complications develop. We wish Jimmy well as he goes through what is likely to be a very tough recovery.